Hi, everyone. Arnie Gottfried here. A lot of parents are facing a really tough decision. I'm in a position that I might be able to help. I'm with Maxi Learning, a therapy for kids with struggle with focus, learning, and self-regulation in Southern Ontario here in Canada. The tough decision that a lot of people are facing is, what do I do now? I can medicate my child. I can provide them with an alternative therapy. Maybe I can do both. And it's a tough decision. If I go with an alternative therapy, I don't really know how effective that'll be, how long that'll take. Usually it takes a longer time. Usually results are incremental. Not all the doctors are backing them up. I don't know, but my heart goes with it because it's not as invasive. On the other hand, if I medicate, I could get some quick results. The school is pushing for it. The doctors are pushing for it. The psychologist is advocating for it. We might have friends or relatives that are saying, hey, it's not so bad. But parents are concerned. The downside of the medication is the side effects. Sometimes they can be very dramatic as well. Side effects, the ineffects. Some side effects are pervasive and they're just not going to, it's a non-starter for parents. So what do I do? Medicate, an alternative therapy. Maybe I should do both at the same time. So if that's where you're at, I've got some insights that might be useful for you, that might be unusual. We're in a certain position here in the therapy world, educational therapy world, that a lot of people aren't. We've had 1,000 children actually go through our program. About 60% of them have been coming to us trying to avoid taking medication. About 40% of them were already on medication when they took our program. So I made some observations here that I actually found extremely surprising. Of the 60% that tried to avoid medication, almost all of them were able to do so for at least a year, many of them for the subsequent 10 years, literally to avoid having to medicate their child because they were able to upgrade their skills. Regarding the other 40% that came in medicated, they were able, 90% of them, to reduce and or eliminate medication as a result of gains their children received. However, very few of them actually reduced or eliminated medication. Why would that be the case? The brain training works on both populations. So I just want to paint a picture. When I decide to medicate my child, I have agreed to a medical model, basically, that this is something that's going to help. So I've already bought in to a certain degree. My default is stick with it unless I've got strong reasons to go away from it. The other thing is, if I see that the medicine has helped settle some of my child's symptoms, the brain training has boosted their skills, and now I try to reduce medication, my child has a bad day, why did I pull? I'm going to ask myself, why did I pull a support from my beloved child? Maybe my child's going to have a bad week. Maybe my child is going to actually have a decline in functioning. Maybe it's transient as he gets used to functioning unmedicated, but with his boosted skills. But still, what is this roller coaster I'm inviting? And I'm going to feel guilty if I've pulled and needed support for my child. So I think because of that emotional dynamic, one would want to think about, what position am I in as a parent when I start medicating my child? Also, if I do medication and brain training, I will not know which one is working, which is great. Maybe I'm going to get some quick results from doing this and that. But, what to do then? So let's think of it this way. A lot of the parents that come to us, the child is 5 or 6 or 7 or 8 or 9 years old, sometimes older, and brain training works at any age in life. Nobody's going to remember your child's grade 2 grades or your child's grade 7 grades, or actually their graduating grades. What we will remember is, how did my child grow and develop? How independent, how happy, how successful is my child negotiating school, home, life in general? So if those life skills can be boosted without medication, and that child is not getting used to, I have a problem, let me take a pill, because things are sort of in the realm of I can succeed when I try, because I've got this boost in brain circuitry that allows me to learn and self-regulate better. My self-esteem is in a different place, and I'm with a slightly different crowd. So something to consider. First, take an effective alternative therapy, such as Maxi Mind Learning. Whatever's left a month or two after you've stopped, you could reassess then. Do I want to try a different alternative, or do I want to try medication then? Once you try medication, you just might not be so ready to stop, even if it would be a good move. So I hope that's helpful. Have a wonderful day, and success to us all.